I'd like to associate myself with the words of the senator from California and commend her for the tremendous work she did on the transportation bill, a bipartisan bill that passed overwhelmingly here in the Senate. Madam President, I'd like to join many of my colleagues who this week are talking each a little bit about the Affordable Care Act, which tomorrow will celebrate its second anniversary of being signed into law by the President. Even though the law won't be fully implemented until 2014, millions of Americans and Minnesotans are already enjoying benefits from important provisions in the law. For example, no child in Minnesota, no child in New Hampshire, no child in America can now be denied health insurance coverage because he or she has a pre-existing condition. Parents across Minnesota and around the country can sleep a little bit easier knowing that if their child gets sick, they'll still be able to get the health coverage they need. That's a big deal. Speaking of parents, young adults can now stay on their parents' health insurance until they're 26. Thanks to the Affordable Care Act, 32,189 young adults in Minnesota are now insured on their parents' policy. Because of this law, health insurance companies can no longer impose lifetime limits on health benefits. Just a few weeks ago, I heard from a Minnesotan in his 30s with hemophilia. He had already hit his lifetime cap 3 times. But because of the health reform law, he still has insurance. And no American can ever again have their health insurance taken away from them because they've reached some arbitrary lifetime limit, and I am proud of that. Now let's talk about seniors. I go to a lot of senior senators around my state. I know the presiding officer goes to senior citizens around, senators around New Hampshire. Because of the health care law, more than 57,000 seniors in Minnesota received a 50% discount on their covered brand name prescription drugs when they hit the donut hole at an average savings of $590 per senior. By 2020, the law will close the donut hole entirely. You know who likes that? Seniors. You know what else seniors like? The fact that in 2011, 424,000 Minnesotans with Medicare received preventive services without copays, such as colonoscopies and mammograms and free annual wellness visits with their doctors. I could go on with what we've already gained, but I want to talk a little bit about a provision that I wrote with the catchy name medical loss ratio, which is sometimes called the 80-20 rule because of my medical loss ratio provision, which I based on a Minnesota law. Health insurance companies must spend 80 to 85% of their premiums on actual health care. This is 85% for large group policies, 80% for small group and individual policies. They must spend 85 in large groups, 80% in small group and individual policies on actual health care. Not on administrative costs, not on marketing, advertisements, not on CEO salaries, not on profits, but on actual health care. And we've already heard that the medical loss ratio provision is working. Plans are already lowering premiums in order so that the companies can comply with the law. For example, Aetna in Connecticut lowered their premiums on an average of 10% because of this provision in the law. Another key provision in the law is the value index. The value index rewards doctors for the quality of the care that they deliver, not the quantity. For the value of the care, not the volume. My home state, Minnesota, is a leader, if not the leader, in delivering high-value care at a relatively low cost. And traditionally, we in Minnesota, our health providers have been well under reimbursed for it. For example, Texas gets reimbursed 50% more per Medicare patient than Minnesota does. Now, this isn't about pitting Minnesota against Texas or Florida. It's about rewarding those states, those lower value states, to become more like Minnesota. Imagine if we brought down Medicare expenditures by 30% around the country while increasing its effectiveness. It will bring enormous benefits, not just to Minnesota, but across the country, because it will bring down the cost of health care delivery nationwide. And that's what we need to be addressing, the cost of health care delivery. Because we all know that bringing down health care costs is key to getting our long-term deficits in order. In fact, there's probably nothing more important than we can do. And that's where the value index is so important. I've gone over a number of the benefits from health care reform that have already kicked in, but I obviously didn't mention them all. For example, health care reform has already added jobs to our economy, according to something called the Wall Street Journal. I barely touched on the great stuff that kicks in 2014, like the exchanges, which will allow individuals and small businesses to pool with others to get more affordable health insurance that's the right fit for them. And of course, while presently no child can be denied health insurance for a pre-existing condition, starting in 2014, no American will be denied health insurance or penalized for having a pre-existing condition. The Congressional Budget Office, a nonpartisan agency of Congress, has crunched the numbers and reported that the Affordable Care Act will ensure 31 million additional Americans and bring down our national deficit by billions of dollars in its first 10 years and by approximately $1 trillion in its second 10. I ask the American people not to fall victim to disinformation. There are no death panels. The Affordable Care Act cuts the deficit. Under this law, businesses under 50 employees don't have to provide insurance for their employees and won't suffer penalties if they don't. They won't have to pay fines and won't be dragged into prison. There is so much junk out there that is just plain false. And it's just doing everyone in this country a giant disservice. Madam President, my colleagues and I disagree on many things. Can we all at least agree to talk about this law in a factual manner? The benefits of this law are tremendous, and Americans across the country are already experiencing them. I urge all my colleagues to acknowledge these benefits and to support the continued implementation of the Patient Protection and Affordable Care Act. Now, Madam President, I'd like to change subjects completely to introduce the Rural Energy for America Program Reauthorization Act, along with my friend Senator Harkin from Iowa. Farmers and rural businesses form the backbone of this country, and rural communities are particularly crucial to Minnesota's culture and economy. In fact, in my state, 1 out of every 5 jobs is related to the agriculture economy. We all rely on farmers for our food. It's thanks to farmers that when we go to the grocery store, there's an abundance of fresh food at cheaper prices than in many, many other countries. And while family farmers and rural businesses work hard to keep our shelves stocked, they do so under difficult conditions. Weather and disease can wipe out a crop. Profit margins can be really small, and fluctuating market prices for their products can be devastating to a family farm. Farm work is also very energy intensive, and when energy and gas prices rise, farmers have to make tough choices. High energy prices mean laying off farm workers, increasing prices if they can, and squeeze budgets all around. To make matters worse, many of our government programs that help manage rising energy prices are under attack and the budget chopping block. REAP, or the Rural Energy for America program, can help farmers manage the cost of energy. The bill that I'm introducing today will reauthorize this important Farm Bill program and help farmers and rural small businesses continue to cut energy bills and generate electricity on site. Let me go through a few examples of what REAP projects can look like. It's putting solar panels on barns. It's wind turbines in fields. There are wind turbines all over Minnesota. Anaerobic digesters on dairy farms, which actually uses waste to create methane gas and electricity. Energy efficiency improvements in poultry houses and geothermal pumps in factories. It means that agriculture producers and businesses can reduce their costs and generate an additional stream of income. It means that rural America can make high-tech investments, create jobs, and lead the world in producing clean energy. I know in the presiding officer's state, New Hampshire, there's tremendous biomass and potential for energy from biomass and the low carbon footprint that represents. The Rural Energy for America program is a modest program, but it's a wise public investment that effectively leverages private funds. Since it was created in 2002, this program has helped almost 6,000 farmers and small businesses across the nation invest in alternative energy projects. The program has generated or saved enough energy to power about 600,000 homes a year. By providing just $192 million in grants and $165 million in loan guarantees, the program has brought in $800 million in private and state investments. Plus, the Rural Energy for America program helps create demand for new jobs in rural economies. These are jobs in installation and operations and maintenance work, good jobs that rural America needs. It also bolsters American energy independence and fosters homegrown energy sources like wind and solar and biomass and geothermal instead of foreign oil. Shirley Hovda's rural wood finishing and coating business, Quality Decorating in Roseau, Minnesota, is one of the 6,000 that have benefited from the Rural Energy for America program over the years. Roseau in northern Minnesota is cold in the winter and in the fall and in the early spring. And when Shirley's heating bills spiked, she decided it was time to invest in a geothermal heating and cooling system to reduce costs in her newly constructed 6,000 square foot facility. With the help of a $7,920 grant from the Rural Energy for America program, she was able to purchase. Time has expired. I would ask for another 2 minutes from the.
Is there objection? Without objection.
Thank you, Madam President. With the help of a $7,920 grant from the Rural Energy for America program, she was able to purchase and install the geothermal system in 2008. Over the past 5 years, Shirley has seen her energy bills reduced by 40%, saving thousands of dollars that she has invested in more productive parts of her business. The bill we're introducing today reauthorizes the Rural Energy for America program to continue helping farmers and small business owners like Shirley to make smart investments in renewable energy and energy efficiency, and it makes improvements to the program too. While the program has had a fantastic impact on the country's rural economy, farmers tell me that they are facing challenges in accessing it. So our bill includes measures to remove barriers while ensuring that taxpayers' dollars are spent wisely. First, our bill simplifies the application process, making it easier for farmers and small businesses to access the program's grants and loans. The new application process matches the complexity of the application to the size of the project. That way, farmers and the USDA can avoid unnecessary and costly paperwork if the project doesn't warrant it. Second, our bill removes a regulation that currently requires farmers to use the program's funding to install a second electric meter that currently goes unread. In these tight fiscal times, I think it's important that every taxpayer dollar is well spent, so the bill will eliminate this redundancy and remove an unnecessary burden on program participants. Third, our bill requires the USDA to include stronger health and environmental criteria when evaluating potential projects, and it expands startup support and funds for feasibility studies so that farmers and businesses can start projects with sound planning. We're very grateful for the strong support from the agriculture community, including the National Farmers Union, the Minnesota Farmers Union, the Environmental Law and Policy Center, the National Sustainable Agriculture Coalition, the Agriculture Energy Association, the Distributed Wind Alliance, the Minnesota Corn Growers, and the Minnesota Soybean Growers. With the chair's with the president's indulgence, I have about 30 seconds left. I have an inner clock, and I think I was up against my 2 minutes. So I'd just like to say I'm really proud to introduce this legislation with Senator Franken, who's a true champion to farmers here in the Senate. And going forward, I look forward to working with all my colleagues from both sides of the aisle to pass this reauthorization as part of the Farm Bill. I see Senator Joe Hans, the former Secretary of Agriculture, my friend there, who I hope to work with on this. Madam President, I ask unanimous consent that the text of the bill be included in the record. Thank you, Madam President, for your indulgence, and I yield the floor.